it was time for the hospital to move, be opened up, this hospital. And it was right in December of 1964. It was a rush to get it down because we needed to get in the hospital before the end of the year because of the state had required that when they were deciding to build a new hospital. From what the hospital did in the beginning to what it does today, it's a completely different world.
I will tell you that just in the amount of time I've been here, I think that the hospital has improved in its overall function. I think it's improved in patient satisfaction. I think it's improved in the way that we actually run the day-to-day operations. I think there's been a huge improvement.
The hospital has always been really progressive in keeping their equipment current. That was an impressive thing. But it's changed considerably. Patient stay days are short now. People who were in the hospital for a procedure, maybe 3 to 5 days routinely. Those are, some of them are overnight, one-day patients, outpatient, and that's a big change. Also, got patients up faster and earlier, moving and discharged. And actually that was a very positive thing rather than losing some of their strength and things laying in bed when they were used to being ambulating.
In 1984, we decided that mammography was the next modality that we were going to do. There was a reason to keep some of our patients here in the town, so we decided to do mammography. It wasn't probably about 2 years later that Dr. Solberg and I wanted to go into the modality of doing ultrasounds for ladies that were having babies. And we made a major move in 1988 when the hospital built the new addition to the hospital to include MRI and CT. We can now send films all over the nation digitally over telephone lines to doctors in New York, whereas before we would have to ship them by mail and it would take 2 or 3 weeks before them to get the images.
And we have adopted a methodology called Lean, which is our own version of a management approach that only a few other healthcare organizations have successfully adopted. Lean essentially puts the patient in the forefront. Patients should see that their time is valuable and we value their time and we're organizing the services around them. So over the last 5 years I've seen a change in our culture as we've become better at starting with the patient and adding value in the eyes of the patient and eliminating waste in our system while keeping a focus on the needs of the patient. We're beginning to see a movement from the illness and injury medical model, which was hospital-centric, to a wellness and prevention model, which will be more likely delivered in an ambulatory setting like our clinics. 3/4 of what we do here today is outpatient-oriented, including clinics, emergency medicine, outpatient surgery, and imaging and other diagnostic services. Healthcare is moving inexorably and at an accelerating rate into the outpatient environment, and we have been in the forefront of that. And so we need to provide facilities, equipment, technology, and the professionals who will staff those venues. The hospital campus will look different in the future. It will be even more ambulatory and clinic oriented than it even is today.